Welcome to our podcast, Sculpted and Unscripted with Dr. Azad. This is an opportunity for Dr. Azad to answer questions that regularly come up during consultations, pre-ops, and post-ops.
Hello. Welcome to another session of our podcast. Hopefully you guys watched the last podcast with Dr. Omar Baitis. It was amazing. We're definitely going to do more of those collaboration in coming months with either with him or other plastic surgeons. So I'm super excited for that. As far as announcement, no. Actually, I'm not going to be here. Well, I'm going on vacation next week. So that's the announcement. What about you, Kim? Are you going on vacation?
No, I'll be in town, just spending the day with my daughter.
Yeah. Nice.
Mm-hmm.
Let me ask you questions. Do you go to vacation a lot, Cern? Or
I should go more.
Yeah, I think so. If you had unlimited amount of money for a week, where would you go? Italy. Like that.
Mm-hmm.
Yeah, nice place.
What about you?
I would go to Ireland.
Oh,
I like the green sceneries over there. Yeah,
nice.
I would do that. All right, so today we're going to talk about different types of implant. What I like about them, I get this question all the time. I'm not married to one type of implant. Our practice, as you guys know, is predominantly primary, secondary breast augmentation, and augmentation mastopexy. So for that reason, we have all the implants. Some of them we do have in consignment, like Motiva, and some of the 5th generation we do have in consignment. But I have an account with all of them. So Motiva, I dedicated the first episode as far as the pros of Motiva, which is amazing. Again, just very briefly, Motiva is the 6th generation, the newest implant. Two good advantage. One is that the shell that covers it is 100% full. So that means the implant is a very, very efficient implant. Even the gel is about the same in all these different implants, but you can see here, there is no divots here in the dome because the shell is 100% full, something we never had before. And then the other thing I mentioned, the smooth silk surface, which your body reacts more friendlier to it, less risk of capsular contracture, and it's just a much more fuller implant. So to advantage of that, if I do want to go subfascial over the muscle, which I'm going to have another podcast just dedicated to under over the muscle, the differences, I definitely go with Motiva, and 100% recommend everyone to go with Motiva. One is the fact that the shell is 100% filled, so you don't have to worry about extra coverage. And the second thing is been shown to significantly reduce the risk of capsular contracture. Also, if somebody had a capsular contracture, prior capsular contracture with other implants, I definitely go Motiva. That's my go-to. But like I said, I love all the other brands that we carry, all of them. Sientra, what I like about Sientra, again, it's been shown to reduce the risk of capsular contracture. And like I said, the gel inside all of them, they're gummy bears. What I like about Sientra is their warranty. It's solid. They have a 20-year warranty for the implant. Also, all of the implant brand, if in case you get a capsular contracture within the 2 years, not only they cover the implant, they also cover some of the fees for the OR fee. Because, in my practice, if the capsular contracture happens or any kind of revision, usually this is my thing, I do not charge for any revision. So any cost will be just a OR and a facility fee. And it's great that these companies with a capsular contraction for the first 2 years, they cover it. But Sientra is unlimited. So even if you get another capsular contraction, this is very, very rare, but the fact is that they still cover it, Or if the implant, or even if you change the implant, you went to Sientra, you put a different implant like Motiva, they still will cover the cost, even though you're not using the same. So they have a very, very solid warranty program. That's one of the reasons I really like it. Allergan, the soft touch Allergan, I really, really like. I think it's a great implant. It gives you a great amount of fullness. It's kind of in between the response and the other one, which is super, super cohesive. I don't like that implant. I think the soft touch is a great implant when it comes to Allergan, and they've been here for a long time. So Allergan is definitely a good implant. The other thing I like about Allergan versus Sientra or Motiva is their variety of choices. They have a lot of sizes, and they have all the profiles, like low, medium, moderate, high, ultra high, and then even within each category, they have so many different choices. Something that we're missing in Motiva, you know, and I brought it up to my rep, which is a great friend of mine. I told him about that. I think they're working on it right now, but that's one of the things again we're missing with Motiva. But that's what I like about Allergan. I mean, they have a lot of variety of choices. Mentor, what I like about Mentor is a boost implant. You know, I think it's a great implant. It's very comparable to 106 Sientra and Soft Touch as far as the quality of the implant. The other thing I like about Mentor is like they have a variety of choices, you know, and they also have ultra size implants, you know. Again, I'm personally, I mean, you guys all know, I'm not a big fan of big implant. Definitely on the primary augmentation, I do not like to put a big implant because I feel like that will kind of destroy the breast tissue. But if this is your third operation or fourth operation and you have someone that is literally wide chested and already had an 800cc implant and they want to upgrade it to 1,000, then Mentor is the one that only company that has the 1,000cc silicone implants. Okay, so that's another thing I like about Mentor. But and the other thing is, like, you know, I get a lot of patients that they come in with a rupture or capsular contracture, what they had with the previous implant company, and they've been very happy with it, and they want to stay with them because they want to use the warranty, or they just like they like what they had and they want to continue with it. So that's another reason that we're not married to one brand. We carry everything here, you know. And when you come in for the consultation, we'll go over everything and I'm going to educate you on all aspects of it. But that's the sort of the main reason that I like every single one of them. Okay. The next topic that I wanted to touch on was the capsular contracture. You know, I mean, since the birth of the breast augmentation, the capsular contracture was always something that we've been battling for many years. I feel like we have come a lot, especially over the past 10 or 15 years, to do certain things that significantly would reduce the risk of capsular contracture. And I'm going to go over all of those in a minute. But having said all that, I mean, I still cannot guarantee, even if using this implant, using this technique, using this method, you're not going to get a capsular contracture. It's like buying a car and then saying you're not going to get in an accident. We can't do that, but the risks are very rare. So one of the things, it's been using the incision. So it's been shown that small inframammary incision versus areola incision significantly reduce the risk of capsular contracture. And that's been proven by many papers in the American Society of Plastic Surgery. So that's my go-to for the primary augmentation. Now, if someone comes in as a secondary augmentation and they already had an areola incision, well, that's a little bit different because they already been through it. And if there's nothing happened, there's no issues, then we don't need to change the incisions. And I usually use the same incision in those cases, so we don't have to create a new scar. The second thing, and the reason for that, they say when you use a periareolar incision, you're going through the ducts, and ducts harbors bacteria, and that's been shown that it will increase the risk of a capsular contracture or scar tissue formation. So for that reason, the second thing that I do, and if you see my videos on our YouTube channel, on Instagram, I always cover the nipple areola complex. That's not for the videos on Instagram because we can't show the nipple. It's just because to again significantly reduce the risk of capsular contracture. Even when I'm doing a breast lift and breast augmentation, for augmentation portion of the case, I cover the nipple areola. The other thing, it's been proven to use a triple antibiotic irrigation with dilute betadine when you're creating your pocket, whether it's submuscular or subfascial. And I do that on any augmentation, and that's been shown to significantly reduce the risk of capsular contracture. The other thing is a sharp dissection on the direct vision. So even though my incisions are extremely small, I mean, you guys seen it is about 3 centimeters, but with a good headlight or a lighter retractor, when I create a pocket, everything is completely sharp. When I say sharp, about 10, 20 years ago, I mean, people use their finger or do the blunt dissection, you know, so without looking at everything. And then that's been again shown to create a lot of bleeding or create a lot of capsular contracture. So everything, what I do is under direct vision and is the sharpest section. Again, there are some videos that I showed in the OR that when you see a canister, it's like there's minimal amount of blood. Okay, when we do the irrigation. The other thing that we do to reduce the risk of capsular contracture is no touch technique. So we place the implant using a device called Keller funnel. Again, there's a video of it too on the Instagram. You can see it, or on our channel. So the implant comes out of the box, gets inside the funnel, and I place the implant inside without actually touching the implant. That's also been proven to reduce the risk of capsular contracture. The other added and advantage of that is that I can use a very small incision, even though I'm placing a moderate size or large size implant. Okay. The other thing we do is like every time we place the implant, we change our gloves. Me and my assistant, we both change our gloves. So put brand new gloves to when you place a new implant. Again, there is evidence of that, but not as strong as the other element that I discussed. But we do that regardless. And then the last thing is like we came along from the implant, it's like from the first generation all the way down to sixth generation, which is Motiva. I mean, that's another huge improvement. Motiva has been shown significantly reduce the risk of capsular contracture compared to other implant. But even the fifth generation too. Again, it's especially with we've seen the study with the Sientra has been shown to reduce the risk of capsular contracture. But Motiva, definitely, that's my go-to implant. That's what I said. If somebody come in with a grade 3 or grade 4 capsular contracture, I highly recommend them to do the Motiva because of their track record and the smooth silk surface that they have. So that's essentially. I'm sure we're gonna see more and more, or learn more things to reduce the risk of capsular contracture. The other thing is like patience elements. So I highly encourage someone not to smoke, because smoking or nicotine has been proven to reduce the risk of capsular contracture. I mean, smoking, you guys know how anal I am, right? I mean, yeah. But it's because it literally increases capsular contracture. It doesn't allow blood supply to get to where we need to get, and just a lot of problems with the smoking. But yeah, so that was it. We're gonna have definitely more topic. Please leave a comment below. Tell me what you guys want to talk, what topic you guys are interested. If you haven't subscribed, please subscribe, like, comment, and we'll see you in a week. All right?
Yeah.
Okay, bye.
Thank you for joining us for Sculpted and Unscripted with Dr. Azad. Join us next time for another exciting episode.